So the objectives of this session are to help you communicate findings clearly, report all important elements of your study, summarize data using table and graphs, and identify key themes in your finding. When students present results, they sometimes make one of two mistakes. Either they include too much information and overwhelm the audience, or they include too little and the audience cannot understand what they found. So the goal is to find the right balance. You want your audience to understand the key message without feeling lost in too many numbers. And at the same time, you should feel more confident about what to present, how to organize, and how to explain your findings. Now, the purpose of the results section is to describe the findings that are relevant to your study objective. Not every number that comes out of SPSS or Stata or Excel needs to be shown. One of the biggest mistakes students make is trying to report everything. And they include every frequency table, every p-value, every graph. So instead, you should ask first yourself, what are the most important findings that answer my research question? And of course, there's no single way to organize results. Sometimes you organize them based on your study objective, and sometimes you put your hypothesis, and then you answer every hypothesis. A useful strategy is to start with tables and figures first, because once you have those, the text becomes much easier to write. Also remember that the text should not repeat every number in the table. The table is there for the details. The text is there to explain the main message or the most salient finding. So when reporting results, you should begin by describing the study participant. Report the original sample size, how many participants were approached, how many were eligible, how many refused, and how many were finally included in the analysis. You should also calculate and report a response rate. This gives reader a clear picture of the study process and allows them to judge how representative the sample may be, and it allows you as well to reflect on, for instance, selection bias. So this is where also to help reader understand is to have a flow diagram for their result. An example of a flow chart from a published study. Flowcharts are useful because they visually summarize how participants moved through the study. So in this example, researchers started with over 1,000 clinicians, then excluded people who did not meet the criteria until they reached the final sample. So using a flowchart in your own work can make your participant selection process easier to understand. This slide illustrates a table where response rates are reported for different waves of the data. So this is a cohort study where we had baseline participants who were invited, and then we had the number of those people who responded, and then the response rate was calculated. And this was done for every wave of the data. So this is as well important, similar to the flowchart that tells us how you came to the final sample. This is important because you will be using it later in your analysis. Tables are very important in research reporting. You should include descriptive table for key variables such as age, gender, education, and other participant characteristics, place of residence, employment, so on and so forth. You should also include analytical tables showing association between exposure and outcome, covariate and outcomes. Finally, if you run a multivariable analysis, you should include a table with unadjusted and adjusted coefficient, p-values, and confidence interval. And I'm including two illustrations. These are the two articles we're going to use to illustrate the tables for descriptive and for analytical type of finding. This table is the first table in the article on burnout among medical doctors, and it presents the participant characteristic, which is really the basic profile of the sample, in addition to the analytical or bivariate association with prevalence of burnout. So if you notice, the first column in both parts of the table present descriptive statistics. So we had 475 doctors who are distributed based on their practice model, their rank, their specialty, in another table in their practice year, age, and gender. But at the same time, we're looking as well at the prevalence also of burnout. 56% have burnout based on one of the scales, 39 on another scale. But with the variable down, we have all these bivariate association. For instance, we have the association between practice model and burnout, and we have a p-value for this for every scale. Similarly for the rank, so the association between rank, so this is the association between rank and both the prevalence of burnout as presented by the Maslach burnout inventory MBI and Mini-Z, so on and so forth. So this table actually combines both descriptive and analytical information. This is another illustration from the study on knowledge and attitude and practice of COVID-19 among physicians in Bangladesh. This table again combines descriptive and analytical information. It shows the distribution of the participant characteristic and also compares the mean knowledge scores across groups. So for example, the table suggests that younger adult, here I look at the younger adult, they might have lower knowledge score compared to older adults. So we have a 13.8 for less than 20 and then 14.63, 14.82. It also shows p-value, the p-value here, to indicate whether the differences are statistically significant. And when you present a table like this, do not read every number, or do not read or do not report every number. Instead, focus on the most important finding. For example, you might highlight that age and monthly income were significantly associated with knowledge score, while gender was not, because the p-value is 0.074. So this helps your audience focus on the key messages from this table. So in the results section, your text should summarize the main finding without repeating every number in the table. So focus on the highlight and use the text to guide the reader. So the reader can always go back to the table and figure to look at the details of the result, while the text explains the most important point. If you have a good picture, a good table, it's really worth 1,000 words. So that's why some people don't like to read text and others like to understand all the data from a table. Most importantly is you have to make sure that your text and table and figures are consistent. So while describing a pattern of a relationship or how the data looks like, you should mention both the direction and the magnitude of the association. So direction means which group has a higher or lower value. Magnitude means how much higher or lower it is. For example, instead of saying that one group had more knowledge, you could say that their mean score was 2 points higher than the other. And importantly as well is when you narrate your result, they should have the same ordering as in the table. And this actually will improve the clarity of the narrative part. There are different ways to organize the data. You can organize variable, a result on a variable according to the order in the questionnaire. So let's say you have a table and you have sociodemographic, and then you have a variable that relates to a reason for not going to the doctor, and you put the result the same way as they are presented in the questionnaire. Okay. Or you can present according to empirical importance, meaning that you start putting the one that has the highest percentage or percent reporting. So instead of showing like 10%, 30%, 45%, you start with 45%, 30%, 20%. So increasing or decreasing order, or according to theoretical groupings. For instance, if the reason are availability, accessibility, or something else, so you group the reasons together and then you present the data. So avoid using arbitrary order because it may confuse the audience. So the audience or the person reading would be zigzagging back and forth in a chart or a table to understand. So think carefully about how your audience will use the information, how you want to present the information, and therefore better organizing the data in a way that will be easy for people to follow up. I'd like to emphasize again, do not present every single finding from your analysis. Focus only on the findings that answer your research question. your hypothesis, your specific objective, because sometimes a study has so many things you can report on. So focus on what you want, what research question you are answering, what are the objective or hypotheses, and use a combination of tables, graph, and short explanation. This keeps the result section focused and avoids overwhelming the audience. So when presenting the result again, and this is something that I already addressed before, first of all, you have to present the table of the principal study variable broken down by demographic characteristic, or maybe main exposure, main outcome. And then you take each research hypothesis alone or one at a time and state the finding clearly, then support it with evidence from tables or figures. So your audience should be able to understand the main message without having to constantly look back at the table. Result could be boring, so you have to really report what you have found. You don't need to interpret the findings surprisingly or what you expected. It's all what you have found. And then in the discussion section, this is where you explain what your findings actually mean. So you can start with a short summary of the most important result, then connect them back to your original research question. For example, if your study found higher knowledge is associated with more preventive behavior, you can explain why this might be important in a public health context. Students often think the discussion is just repeating the result in word. It's not. You should not put result in the discussion unless you're talking about like you found high magnitude of burnout, but you don't have to again put the number. Maybe just say that the prevalence that you found in burnout is similar to what's reported in the literature. So the discussion is where you interpret the finding, compare them with the literature, and discuss strength and limitation, and explain why the findings matter. So what are you going to do with the findings, and how others have used similar findings. So you should also be honest about the weakness of your study or the shortcoming of your study. Again, no study is perfect. Acknowledging the limitation actually makes your work stronger and more credible. But at the same time, you have also to talk about the strength. So what's really good in your design and what makes it really internally valid. And of course, you have to mention the theoretical, practical implication and discuss possible future work, whether short-term, long-term, whether you recommend the further research based on some shortcoming of your project, or you are ready to present some action-oriented or policy-related recommendation. So now I'm going over the details of the components of the discussion section. So in the discussion, you compare first your result with others from previous study. So discuss possible sources of bias, such as selection bias or information bias. Think about whether there were problems with recruitment or data collection. And if you suspect bias, explain how it may have influenced your result. And then very important is to discuss confounding, especially if it's an analytical type of study where you are looking at association. There's always part that could be explained by a confounder, a covariate. So you have to identify the variable that may explain part of the relationship and explain whether you have accounted for confounders, you have measured confounder, and whether you were able to control or you still have some residual confounding. So even after the adjustment, you still have some effect of a confounder. You can also discuss whether your findings support a possible causal relationship after making sure that it is statistically significant, is bias-free, and it's not related to a confounder, is to assess whether it is causal, and then try to explain if there is a biological explanation or particular causal pathway. And at the end is finally think about future research needed. You can suggest epidemiological, clinical, or laboratory study. You can also discuss policy implication. For example, if your findings suggest an important public health problem, You can explain what type of policy or intervention may be needed, whether this data should go to the Ministry of Public Health, Ministry of Social Affairs, if this data should be brought up to the Order of Physicians, to the Society for Cancer, and then end by considering how confident you are in making these recommendations based on your study finding. You cannot make recommendations that are not related to specifically what you find in your data. So this slide illustrates a very simple table that presents demographic characteristic of a sample of 3,500 Lebanese or adults who were surveyed for musculoskeletal disorders. Based on this one is basic demographic characteristic: governorate, age, gender, marital status, education, and income. This is another one that's descriptive, that is also portraying the pain intensity and disability among participants with rheumatic diseases, specifically looking at the proportion who reported pain, the intensity of pain, whether they have disability, and dividing or stratified by mechanical diseases versus inflammatory diseases. This is very nice, because you need, when you talk about, for instance, musculoskeletal disorder, not only to describe the participants who were there, but also who are suffering from pain that's related to rheumatic diseases, and which are which has higher pain levels, so on and so forth, and which causes more disability. Again, these are not analytical, but just descriptive. Okay, this is an illustration of another clear table that presents the frequency distribution of some variable among cases under control. This is particularly a study on knee osteoarthritis and trying to find what are factors associated with knee osteoarthritis in Lebanon. It also not only reports number and percentages, but it also reports measure of association. The OR here is an unadjusted OR, because it is based on bivariate analysis, and the p-value for every association with enough explanation of what's in the table. And this is only, of course, it's a partial table, not a complete table. And finally, this is a final table to show a multivariable logistic regression, again, of the same study, to look at what are the significant factors associated with knee osteoarthritis in Lebanon. That was done by your professor Nabil Ayoubi. That was his MS thesis. So what he found is that the Bekaa, people who reside in the Bekaa, have 26.4 higher odds of knee osteoarthritis compared to those in Beirut and Mount Lebanon. And this is independent of their body mass index, type of job, family history of the disease, and monthly income. And what also was significantly related was also the body mass index. Overweight and obese were associated with higher odds of knee osteoarthritis. Agriculture type of job was not related after controlling for other variable, neither the family history of the disease nor the monthly income. So what was important was where people resided and the body mass index. And that was really, I think it's clear table that, so in this table you can also add the unadjusted and adjusted and the p-value. So it tells you the whole story, and this is what you should have in a table. That you should be able to understand the table without going back to the text. And when you have the text of the result, you should be able to understand the text without going to the table, unless you want to look at details. All the best when you present your result in the oral presentation or in your manuscript.